Welcome to topic 4 of abnormal psychology. Today we're going to be talking about the clinical assessment and diagnosis. We've almost all taken an assessment at some point in our lives. It could have been at our primary care doctor to get a checkup, or it could have been at our dentist. When we receive a mental health clinical assessment, it is a way for professionals to develop a summary of our symptoms and our problems. It is done to establish a baseline of where we are at any given moment in time, and it also uses interviews, observations, and psychological tests to help clinicians to arrive at a disorder based on the most recent DSM, or Diagnostic and Statistical Manual. An assessment usually starts out with the presenting problem or what issues brought that person in to see the professional that day. It may also consist of a general medical exam, information about the person's behavioral history, developmental history, intellectual functioning, different personality characteristics, and any social or environmental concerns, as well as a past history of substance abuse, incarceration, or even hospitalization. Professionals want to get a realistic picture of how that person interacts with their social environment, and they can do this through interviews or behavioral observations. When professionals conduct psychological tests, they can be used to establish IQ, or the intelligence quotient, to determine personality characteristics or deviances through a variety of psychological testing. Once the assessment is finished, the clinician typically has enough information to establish a diagnosis or a classification of what kinds of problems that person is experiencing. Using the DSM, the client's symptoms are categorized and then labeled. An assessment can help a person to really take a look at their life's history and establish some problem areas, or to look for patterns. It can be done to help a person learn more about their illness, and through the DSM classification can seek appropriate treatment or medication. The problem with labeling a person with a mental illness is that stigma is everywhere. In mental health, we try to remain person first, which means we realize that the person is there first and foremost, and then the illness. And we want to avoid stigma and remain consistent with our ethical codes. And that is our topic for today: clinical assessment and diagnosis.